Okay, so today we're going to talk about a spinal cord model, and I know that this is upside down, but this is the best way that I can do this with video and with my iPad by myself. So the first thing you're going to look for is you're going to look for a dorsal root ganglion, and I call that the knot, and it's going to be right here. So if you find that, then that's the dorsal root ganglion, and that's going to let you know that this right here is the dorsal root. And then if this is the dorsal root, then this has got to be the ventral root. And then these two roots are going to converge and they're going to form this spinal nerve, which is right here. So you have spinal nerve, dorsal root ganglia, and then here you have ventral root, okay? So then if you look back over here, you have a bunch of parts in the middle that you have to know. So you need to refer to your spinal cord list that you got in lab that had a picture and a list, and that'll show you all the parts. And it's good to look at that list and look at the words and look at how they're spelled as we go. So I'm going to tell you a story as I go. I told this in class, I'm going to tell it to you again. It's just an analogy that will help you remember these parts. So if you have this part right here, and I call this the butterfly-shaped amusement park. So here's the butterfly-shaped amusement park. That's gray matter. Out beside here, well actually out around here, is your white matter. Okay, so this is the butterfly-shaped amusement park. And this is the area outside. And let's pretend that you have a lot of children and they're driving you crazy. And you can take them to this butterfly-shaped amusement park and drop them off. So inside, children. Outside, parents. So the parents are out here having fun. So the outside part I call this part right here. You're going to have the dorsal or the posterior funiculus, which is all this white matter down here. And then if you're up here having fun, you're going to have a different type of funiculus. So if this is dorsal, because here's the dorsal root ganglia, then here has got to be ventral or anterior funiculus. Then if you're out here on the sides having fun, white matter on the sides, that's going to be lateral funiculus. So you have dorsal or posterior, anterior or ventral, and lateral on the sides. Okay, so if your kids are in here and they get really bad, they're going to go to this pinched in part in the center where there's a person called the gray commissure. The person is the commissioner. So his name is Gray, he's the commissioner, he's in the middle. Kids go there if they're bad, okay? And you can't really see it on this model, but there's a itty bitty hole right here. So sometimes the commissioner will take a break and he'll go down this little hole, like a little rabbit hole, and that's called the Central Canal. So let's review that part. This is all gray matter. And what you have is, you have a pinched in part in the center. The pinched in part is called the gray commissure. The hole down the middle is called the Central Canal. And there's some other parts on here you have to know. Let's pretend that you have some kids that are being bad, and you're telling them that they have devil horns. So you have horns here. These horns are on this ventral side. So this ventral side, these are going to be ventral or anterior horns. These are going to be, if horns are coming out the front, these are going to be posterior or dorsal horns. And there's these parts that stick down. And then you have these parts on the side. These are going to be lateral horns, right here and right here, that stick out on the side. So you have anterior or ventral horn, dorsal or posterior horn, lateral horn. And then you have the commissure in the middle, which is the gray commissure, and you have a central canal, which is the hole in the center. And you have a couple other parts, and then we're finished. This portion right here, and a portion right here. So this is on the dorsal side, or the posterior side. This is called the posterior median sulcus. So you have a student in the back that's sulking in the back. So posterior median sulcus. Median because it's in the middle. Then you have up here, you have anterior median fissure. So if you have an ant and you pour some acid or something on it, hydrochloric acid, and it fizzes, not that I would do that, but here's going to be the anterior median fissure. So the ant fizzes and the person sulks in the back. And that's all the parts for this that you have to know.